Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health, one topic at a time. So guys, today I'm going to talk about something I've been meaning to bring up on my channel for quite a while. It's something I'm really passionate about. It's medical grade Manuka honey. I'm fascinated with medical grade Manuka honey. In fact, I'm fascinated with Manuka honey on the whole. So if you want to hear all about it, just keep watching. Yes, I've been meaning to talk about medical grade Manuka honey for a while on my channel, and what happened, what kind of catalyzed it for me is I burned myself several days ago. Got a little bandage here. It's just actually really small. It's one little line. So I cut the gauze is quite larger than the burn. But I decided I was going to talk to you guys about medical grade Manuka honey, not only how I use it for burns, I use it on cuts and scrapes and things like that. And I've just had a long history with it and I find it really fascinating. Let me say my usual disclaimer, which is that nothing that I say on this channel should substitute for the advice of your own qualified practitioner. I'm not giving any individual medical advice on this channel. That said, I'm going to be telling you about my own experience, what I've done, and maybe you can take something away from that. Now, you will find all kinds of honey, certainly in grocery stores. You will even see Manuka honey in those stores. I would be extremely cautious. There's only 2 brands from who I will buy my products. That doesn't mean there aren't more out there that are fine, but it did take a lot of research and a lot of digging to find out who does what testing. And there's just too many things out there that aren't regulated. And it is something to be a little bit concerned about if you're going to be using this for something like topical application on the skin. Not so much if you're going to be ingesting it. Take whatever honey you like. If you're buying it for the taste or to put in your tea, it's not completely settled science as to how much of the benefit you can get from Manuka honey that is unique to Manuka honey. So there are some studies that indicate that some of the benefits you get from Manuka honey you might get from lots of different honeys across the board, even with wound care. I would be really careful about that. And, I personally have just had such a good experience with the medical grade Manuka honey that I just don't see, trying anything that's any less potent and any different. It's not just a potency thing. Manuka honey is just a very different honey than others that you find on the store shelves. Honey in general is antimicrobial. It's got a very low pH, which means it's very acidic, and that is discouraging of microbial growth. In addition to that, most honeys have a lot of peroxide in them, and we know that peroxide cleans a wound. If you've ever put peroxide on a cut or something, a scrape, it stings like crazy. It bubbles up. That's the peroxide action, and then very quickly it's gone. Now I'm going to talk in a minute about Manuka honey specifically, and that also has non-peroxide action, and it's that keeps it antimicrobial and particularly healing to wounds after the peroxide is gone. So then what's unique about the Manuka honey other than that it's gotten from the nectar of the Manuka tree flower? Well, Manuka honey in general is thought to be much more profoundly antimicrobial and more healing because of its non-peroxide activity. Now, Manuka honey has different kinds of classifications. It's graded. So you might see MGO, the methyl glyoxal content. You might see something called UMF, unique Manuka factor. There's all different kinds of designations they'll put on the jars so that you can kind of get a sense of how one compares to another. Just they're not really a linear relationship between unique Manuka factor and MGO. So the methyl glyoxal is a naturally occurring compound in Manuka honey. So the MGO that you see on the label is just a measurement of that. You might see MGOs at 200, 400, 600. The higher the number, the more antimicrobial and the more healing. The preparations of medical Manuka honey that are meant for applying topically on the skin are going to have the higher number, okay, the higher MGO, like 400, 600, something like that. Now, unique Manuka factor takes into account a few things. First of all, it does take into account the MGO. In addition to that, it takes into account the leptospermum, which is also unique to Manuka honey. And finally, it takes into account something called dihydroxyacetone. Now, I'm not going to go into that. It's beyond the scope of this video, but that's just to show you that there's not a perfect correlation. So a medical grade Manuka honey that's meant to be applied topically on the skin will probably have a unique Manuka factor, a UMF, of somewhere of 10 or greater. Now, I've just got a brief list here that I've jotted down a few things, some of the conditions for which Manuka honey has been shown to be helpful. So the first thing on that list is wound healing, and that would be in particular medical grade Manuka honey, to which I just referred. Now, there are even products like bandages and dressings that are impregnated with honey, gauze that's impregnated with honey. You don't really need that for something like, a simple little superficial burn or cut or something, I'm going to show you how you can sort of mimic that sort of a dressing with your own gauze. What's really interesting to me is that in case reports that I've read and some other kinds of like retrospective studies, they all have this common denominator where they started out trying this and then they tried that and they tried another thing, and it gets written up in a journal because they decided as a last resort in a desperate attempt to go ahead and use some medical Manuka honey on the wound, and that clears it up. So I kind of wonder why, for people who have studied this, at least for the people who have studied it, why is it the first thing they reach for? One of the really interesting things about medical grade Manuka honey is that unlike other antibiotics, the bugs don't become resistant to it. So you don't grow these super bacteria that are resistant and then you need a different antibiotic the next time if you didn't quite kill it all. That doesn't happen with honey. Yeah, so anyway, back to my list. So another benefit of Manuka honey has been oral health. I know that's sugar, it doesn't make sense. The bacteria that cause gingivitis is susceptible to Manuka honey and probably other honeys, but I don't know that it's been studied. Third of all, it soothes a sore throat. I think that we've all heard that by now, and I also think that probably happens with other honeys just as much as Manuka honey. I don't know if there's been a study comparing them. There's some indication that it can help prevent gastric ulcers. Now, not treat them, but prevent them. Well, gastric ulcers are caused by a bacteria, H-pylori. What's interesting as a side note is that was first discovered by a gastroenterologist in Australia, the same person who determined that ivermectin is helpful against COVID and has written on it extensively. I did an interview a while back with a doctor who's using ivermectin in his COVID patients. Yeah, I'll link that right here. It's probably the antibacterial component. It's probably that the H. pylori is susceptible to the antibacterial component of the Manuka honey, and that's why that would be preventive. Some studies say it might improve digestive symptoms. Yeah, I don't know. I'm kind of torn on that one. There are some really interesting, very early studies that looks like it may help with some of the upper respiratory symptoms with cystic fibrosis. People with cystic fibrosis have very thick secretions in their lungs, and because of that, they're particularly prone to getting upper respiratory infections, and those upper respiratory infections are often caused by bacteria that are susceptible to the medical grade Manuka honey. So it might be helpful to those patients in keeping their secretions thinner by not allowing the bacteria to proliferate. And then finally, there's some evidence that Manuka honey is helpful with acne. I don't have any personal experience with that. I'm going to link down below in the description box the citations for several different studies so you can browse through those. So now over to me and my own personal experience. I have used medical grade Manuka honey for years, particularly on wounds. There's only 2 brands that I'll buy. I'm going to go over both those brands with you and tell you some of the pluses and minuses. Again, I'm not giving any medical advice on this channel, so please talk to your own provider before you use this for something other than a very superficial kitchen burn or wound. I actually have had some experience discussing this with a surgeon. He had to make a tiny little incision, left me a little bit of a wound there, and was telling me to just keep it dry. That's sort of the standard, keep it dry, keep it dry, keep it dry. And dry sort of hurts, right? Dry wounds that form scabs. So I talked with him about medical honey, and it was interesting because the first thing he said was, well, I'm not adverse to it. I get it. I hear that it's antibacterial. I hear all that too. And I assured him I wasn't talking about going to grab something at the store, like running to 7-Eleven and getting a jar of honey with the little bear shape. But, he said one of the problems with it is that I want to keep the wound dry. Surgeons are all about keep it dry. And he said, I don't want something wet there. So, the interesting thing about Manuka honey is that those 2 things aren't at odds with one another. Manuka honey, and probably all honey, but I know for sure the Manuka is very hypertonic. And hypertonic is sort of like salt, it's thirsty. It takes the water away from whatever it's next to. So it will tend to pull the fluid out of the wound. Now it keeps the top nice and moist so that it's more comfortable and it's soft and it doesn't tend to heal with a scar. You just get a nice smooth area that heals, but it doesn't keep the wound wet. It actually does keep pulling the water out of the wound so that the wound can heal from the bottom up. If this were a deeper wound, which it's not, what you would see is if you put a layer of honey there and then put the gauze over it, and I just have a clear adhesive, what's called a tegaderm on top, and I'm going to show how I do all this. But what you would see is you'd put that honey and then the gauze on and then the clear bandage, and then you'd watch it, and it would look like this for like the first day or maybe several hours, depending on the depth of the wound. And then over time, you'd see that this gauze was starting to soil, sort of the color of the honey. That's the honey pulling that fluid out. And that's why you have a gauze there. Because if you just put something like an adhesive bandage over it, that fluid doesn't have anywhere to go, and it'll actually start to dislodge the adhesive of the bandage. So you have the bandage there so that you can give that fluid somewhere to go and let the honey do its job. And then when that becomes wet looking, then you know it's time to change the dressing. And then you just take the whole thing off and start over. You wouldn't really want to clean it with soap and water or anything. You might just want to like wipe around it, and you put a new layer of honey, a new gauze, and a new Tegaderm on top. I don't know if the surgeon I talked to at the time bought it. I actually went home and did it, and I got a beautiful result. Again, I'm not recommending that, but I'm just saying what I experienced. Now, this I have taken pictures of. This was just a very superficial little burn. I was basting something, and I touched this to the rack right above it, and you get that little line. I did take, a few days before I decided I really ought to put the honey on it because it was forming a scab, which is painful. So I prepared a little demo where I showed exactly how I dressed this, and I'm going to insert that. And then after that, I'm going to talk about the 2 different brands I referred to that I buy of Manuka honey. Okay, so here I am. I've got that little bit of medical grade Manuka honey on that burn, and I just cut off a piece. This is from a 2x2 piece of gauze. I probably cut off 1/3 of it to make a strip. Now, this is this isn't sterile really, so I went ahead and I saved the rest of that gauze and I put it back here. If this were something like a surgical wound, of course, I would not ever, cut something in a manner that wasn't sterile, put it back in the package and keep it for later. This is called the Tegaderm. Now, they make all different kinds of these, so there are generic equivalents. I think McKesson makes one. But if you search Tegaderm, like on Amazon, you will find this one and others. And all you do is you pull it, you peel it down, and it looks like this. And so it's like an adhesive saran wrap, but it's sandwiched between 2 other layers that we're going to peel off. So obviously they can put it in the package and it can be handled without being ruined. So you'll see that there's like a little lip here where it separates. And when you separate it, this one piece that looks like wax paper, you discard, and now you've got this piece that has a little window. The side that the wax paper came off of, which is here, that's sticky. So kind of like saran wrap on steroids, you don't want to touch that because you'll never get it unstuck to you. And I just placed that like right on the center. And then what you do is you pull from these little pieces that are already, there's a cut here between the 2 ends. I can't seem to do a video without like 100 interruptions, like the phone keeps ringing, whatnot. So anyway, you pull on this end and it comes off. And then I just fasten it down. This will be good. I mean, you can shower with this. I mean, it wouldn't last for days and days, but 24, 48 hours, probably even a little bit more. But this allows you to then observe the gauze. Okay, now this is a really superficial thing. This is your very superficial burn here, and just like a very superficial cut, you're not really going to see the gauze get wet and soiled over time, but you do want to be able to watch it because the way medical Manuka honey works is it is hypertonic, so it will pull fluid out of the wound, and eventually this gauze will become wet under there, and that's how you know it's time to change the whole thing and redress it. I don't expect that with this. I just kind of on principle to let my skin breathe, wait 2 days, maybe 3 at the most. Now, one thing you notice right away is that burn stops burning with that honey. It's very soothing for the burn. I've read about all kinds of these tricks and tips about burns, and I haven't found one that really helps alleviate the sensation like honey. So that's the bandaging procedure. Now at the end, I'll insert some pictures so you can see how nicely this is healing. I think I got like day 1, day 3, day 5, something like that. Onto the brands of medical grade Manuka honey. Now, I don't have a quarrel if you want to buy almost any old kind of Manuka honey because you want to put a little bit of it under your tongue every day and maybe you have throat symptoms. But when it comes to something that I will put on my skin, that's a whole different story. It gets really dicey. So there's 2 different kinds. I use one by Manuka Guard, and I'll use another by a company called Meta Honey. Now, I think these are both very different, and I'm going to talk about that. Meta Honey is made by Derma Sciences Inc. and it's sold by Integra. It seems to be really marketed more for hospitals and healthcare systems and wound clinics. It's a little bit hard to find your way to buy this yourself. They do have a consumer line where you can call. I'm going to put all that down in the description box. There's one flat shipping fee no matter how much you buy, so think about that. Decide what kind of quantity you're going to want, which products you might want, because you don't want to pay for the shipping all different times. Now this comes in two forms. It comes in what's called a gel and it comes in what's called a paste. The gel is specifically marked, and if there's nothing marked, then it's the paste. It's a little bit of a misnomer. So this is the paste. It's a bit of a misnomer because all the paste is pure medical grade Manuka honey. Now, they have done something to irradiate all of these honeys from botulism, but the thing that's different with Manuka honey is they don't subject it to really high heat because that might destroy some of the healing components. So it's done with light, it's done very carefully. I suspect that this one is maybe a little more irradiated than this one. That's just what I suspect, because while I find that this works, I have found that this one works much quicker. Now, on the other hand, you might have more of a comfort level with the fact that this is in a tube. It's a medical product. It's obviously FDA approved. They're selling to medical facilities here in the United States. And yeah, it's in a tube, right? So you're not like dipping anything in like in a jar. You just squeeze it out. So the paste is just pure Manuka honey. It really doesn't have a quality of a paste. I think about paste like being very thick. It's really not. I think they should, just say Meta honey. Now, the other one that they make, which is called the gel, that one is kind of thick. And what that is, just so you can remember and keep it straight, it's got 80% medical grade Manuka honey, and the other 20% of it is some gelling agents so that it actually stays where you put it. Because sometimes you want to put this like on a knuckle and then put a bandage around that or something. So if it's on an area of your body that bends or moves, it's not like this where it's nice and flat, then that might kind of ooze and things. So if you buy the gel one, it tends to stay put, and it really does do a good job. So I have both the Meta Honey Paste, which is plain old honey, and the Meta Honey Gel. The Manuka Guard is a little bit of a different story. So, you can see right away this is in a jar. So you have to dip something in there and take it out. Now, I was kind of concerned at first until I learned all about this particular honey. I'm quite sure, I've had this for about a year. I'm really pretty sure I could send this off to a lab at a university and they'd find that nothing is growing in here. I don't even think this is possible. I'm going to put some links to some videos down below where you can hear Professor Peter Molan from university in New Zealand speak. I think he passed away, but he was really the grandfather of the whole medical Manuka honey, and he really uncovered its properties and studied them in the lab. And I'm just convinced after watching his work that nothing is going to grow in this jar. That said, I'll only put something clean, like a clean implement to get a little bit out, a clean knife, or if you want to, you can get a sterile tongue depressor and open it in a sterile way. That would certainly be a way that you wouldn't have to worry about introducing any microbes into the jar as long as you only dipped it in once and threw it away. I haven't really had a problem, guys. So I do use this one and I feel that it works faster. I wonder if there's something about the fact that this is not marketed to medical facilities as a medical product. Perhaps it's not treated as harshly as this one. I don't know. This one, given that it's a plain old jar of honey that you can buy, it does give you an MGO. It says 400. So if you look at some of the methyl glyoxal in the charts where they say, well, a medical grade would be, usually they say higher than 400, but the more specific is the UMF, the unique Manuka factor. That should really be, over 10-ish. This one is unique Manuka factor of 12. You can see there on the top. I've used this for a long time and I've had really good results with it. I'm going to link both of these below in the description box. These are not affiliate links. This one actually has an incredible affiliate link program, but I'm not using that because I don't want the room for bias that commission would create. Again, I do recommend that you talk with your own practitioner about using this for something that's any more than like a cut, scrape, a very superficial burn. That's a limited scope we're talking about using it with today. What I went through with a previous surgery, that's sort of a sidebar. Now, one thing that I have to say is just great about using Manuka honey for just superficial burns is that unlike all the other tips and tricks I've heard about and read about, do this for a burn, do that for a burn, toothpaste, oil, ice, all these things, nothing seems to ever stop it from burning except medical grade Manuka honey. I don't have any burning once I do this. I don't know why I didn't do this the first day it happened because that's really when it's best and it goes to work quickly and it's usually gone in like 24 hours. But of course I waited till it was like starting to scab. But it really does stop the burning. That plus what I'd already said, which is that you don't tend to have the scabbing. It doesn't form that hard outside crusty scab. That's actually what contributes to pain when things are healing. It also contributes to kind of a jagged, rough area that takes a while to smooth out. I found that when I have a honey on a wound, particularly early on, it just heals really smooth and beautiful, and you just don't feel it. You could run your finger across it, and you don't feel that anything was there. So I've just had great results. So I'm going to take this off. We're going to see how it is because today is like day 5, I guess. And I'm going to insert pictures along the way. That's my experience with medical grade Manuka honey. Let me know if you guys have any experience with this, if you're interested in it. If you do try it, let me know how it goes and what you think about it. And until next time, be well. Bye-bye.